Hey everyone, there's a lot of fear out there about a possible link between taking paracetamol during pregnancy and a child's risk of developing autism. It's a scary thought for any parent. But what does the scientific evidence actually say? In this video, we're going to break down the facts, not the fears. Here's the most important thing to understand. There is no robust evidence to support a causal link between paracetamol use during pregnancy and autism. It's a critical distinction to make. While some studies have found a small association between the two, this does not mean that one causes the other. Think of it like this. People who take paracetamol are often doing so to treat an underlying condition like a fever, an infection, or pain. These conditions themselves can be risk factors for adverse pregnancy outcomes and may also be linked to neurodevelopmental issues. Scientists call this confounding by indication. For example, a severe, untreated fever during pregnancy can pose a greater risk to the unborn baby than the paracetamol itself. Many of the earlier studies that suggested a link had significant limitations. Recall bias. They often relied on mothers remembering if they took paracetamol years earlier, which is highly unreliable. Confounding factors. They didn't always fully account for other factors that could influence a child's health, such as genetics, parental health, and other environmental factors. However, some of the most rigorous recent studies have used national population-based registries and even compared full siblings to control for shared genetic and environmental factors. One large study from Sweden involving 2.4 million children found no evidence that paracetamol causes autism when comparing siblings. This is why major regulatory bodies and health organizations worldwide, including the Medicines and Healthcare Products Regulatory Agency, MHRA in the UK, the European Medicines Agency, EMA, and the American College of Obstetricians and Gynecologists, ACOG, in the US, continue to recommend paracetamol as the first-choice pain reliever for pregnant women. Their advice is based on a rigorous assessment of all available scientific data. They state there is no evidence to support a causal link. The key takeaway is to use paracetamol responsibly. As with any medication during pregnancy, it should be used at the lowest effective dose for the shortest possible duration. If you have questions or concerns, always talk to your doctor or pharmacist. They are your most reliable source of information. Thanks for watching. I hope this video brought you some clarity. Share it with anyone who needs to hear the truth behind this topic. Don't forget to like and subscribe for more evidence-based health information.